Hello, this is Layla Michael, and I'm going to be doing my video presentation. Research Proposal Review, HIV Prevalence Among Black Transgender Women in the U.S. Black trans women and their fight against HIV. Overview. This research proposal is designed to provide compelling evidence to support the importance of exploring why the prevalence of HIV among Black transgender women is exorbitantly high. Furthermore, the Statement of Purpose, Literature Review, and Methodology sections will provide further support to strengthen the position of the researchers' desire to study this health issue. Statement of Purpose Review. During the onset of the human immunodeficiency virus, HIV, epidemic of the 1980s, countless lives were lost during the early years of the virus. This mainly included members of the lesbian, gay, bisexual, transgender, LGBT community. Despite the triumphant strides medical researchers, scientists, and governmental agencies have made, HIV still threatens the lives of many Americans. According to the Centers for Disease Control and Prevention, in 2016, there were 39,782 new cases of HIV in the United States. The majority of those cases, 10,223, were comprised of Black men who have sex with men, also referred to as MSM. The most vulnerable and oftentimes overlooked subgroup within this demographic is Black transgender women. The CDC has reported that the percentage of new HIV cases among Black trans women was 3 times the national average. This data gives salience to the CDC survey conducted between 2014 and 2015, which indicated that nearly 2/3 of transgender men and women reported having never tested for HIV at all. The HIV crisis among Black trans women is most severe in the South, which comes as no surprise since the South, while only comprising 37% of the country's population, accounts for 54% of the newly diagnosed HIV cases. Additionally, 21 of the 25 cities with the highest HIV/AIDS prevalence among Black MSM men in the country are all in the South. Social determinants of health underlie the particular vulnerability of Black trans women to HIV. The trans community at large face high levels of discrimination, violence, and marginalization. Yet, according to the Transgender Law Center, a national nonprofit agency, Black trans women experience shockingly high levels of violence and are murdered at a rate far higher than their white, Hispanic, and Asian counterparts. Hence, the disproportionately high level of discrimination Black trans women experience directly impacts their socioeconomic status. As a result of this discrimination, many Black trans women have turned to prostitution to survive. Trans sex workers often engage in a sexual practice known as barebacking, which refers to sexual intercourse without condom usage. This is markedly the case among Black trans women, whom studies indicate have a higher tendency of engaging in unprotected sexual intercourse with multiple partners. This study will examine the social health determinants and socioeconomic factors that impact Black trans women's health behaviors in order to determine whether the direct correlations exist. This topic is important to study since there is a lack of available research specifically focusing on the exorbitantly high prevalence of HIV among Black trans women. Furthermore, this study would explore why condom usage remains alarmingly low for this demographic. Condom usage is one of the most important interventions in curbing the continued spread of HIV domestically and globally. However, many individuals do not know how to properly use a condom, which can impact their confidence level and lead to continued unprotected sex. Social determinants such as lack of publicly funded community health centers that distribute free condoms also affects the access to condoms among the transgender population. Another area this study will briefly explore is the role of race in accessing HIV prevention information and testing among Black trans women in America. For example, during the onset of the HIV epidemic, the health marketing literature in print media exclusively consisted of brochures, magazines, and posters and other health education materials that portrayed whites as the representative victims of the virus. This in turn created a popular perception that only white Americans were contracting the, at the time, deadly virus. Finally, the cutting of funding for outreach programs in health centers in the South due to a false perpetuated narrative that the threat of HIV has subsided further widens the barriers to care, which this study will delineate. Literature review. Low condom usage among Black trans women. There is research to support the link between low condom usage and higher rates of new HIV cases among Black trans women. Although condom usage is generally low for transgender women, it is significantly lower among Black trans women in the United States. The research suggests it stems from poor access to condoms, poor health literacy, and sexual health education. Condom usage is an integral method of primary intervention to curb HIV spread. Furthermore, research indicates that a major contributing factor in low condom usage for this population is low self-efficacy in condom use. Contrary to popular belief, condom application and use is not intuitive. As a matter of fact, it can act as a nuisance, which in turn creates a barrier for many without access to proper training and education. Barriers in accessing care. In the southern states in the US, HIV rates are disproportionately higher for Black men who engage in MSM in comparison to the rest of the country. However, as referenced in the Statement of Purpose section above, HIV rates for Black trans women is 3 times higher than the national average. Researchers have explored the contributing factors for the alarmingly high rates in this demographic. The following barriers to care have been identified by researchers studying new HIV cases for the demographic. Access to care, poverty, racism, transphobia, health literacy, education, and socioeconomics appear to be the biggest barriers for this demographic. Pre-exposure prophylaxis, also referred to as PrEP, is a breakthrough tertiary intervention. The medication is designed to curb the spread of the virus for at-risk individuals who have not been exposed to the virus. Although the PrEP medication has been available since 2012, many at-risk individuals are still not using the medication due to feeling unsure about how it works and the drug's possible side effects. Researchers have stated the efficacy of PrEP relies on patients ensuring that their uptake of the drug is high. Greater uptake and adherence to the drug has been correlated with a stronger protection against the transmission of HIV. In a cohort research study conducted in 2014, researchers recruited 1,603 HIV-negative MSM and trans women participants who engage in condomless anal sex regularly. Researchers determined that the participants who had an uptake in PrEP, 76%, experienced a significantly lower incidence of HIV development. Furthermore, in another study conducted in 2016, researchers determined that despite the effectiveness of PrEP HIV prevention, continuum of care was integral to ensuring the curb of new HIV cases. Accessibility and cost are directly impacted by allocation of federal funds to HIV prevention programs. Limitations. The limitations in this study stem from the lack of research available focusing solely on Black trans women. Black trans women suffer from HIV at disproportionately higher rates versus their white, Asian, and Latino counterparts. Despite these harrowing facts, there is a dearth of available research exclusively focusing on this demographic. Researchers need more funding in order to conduct more targeted studies on this population. This is in part due to contributory barriers, namely in the form of race, which uniquely affect the Black trans community. For example, Black Americans, regardless of gender identity, have experienced palpable discrimination when attempting to access care, and the problem remains on the front line of the nation's racial divide today. Methodology review. Qualitative research design. We will be utilizing a qualitative approach for the proposed research study. The research question is aimed at examining the high degree of prevalence of HIV among Black trans women. A qualitative design would be appropriate for this study since it explores the participants' experiences and narratives. It takes a holistic and anthropological approach to investigate why this problem persists. Furthermore, it explores the lives of the participants and tells their stories in a more vivid and nuanced way. This would lead to more substantial explanations as to why these individuals make the choices they do surrounding their sexual health. For the qualitative research design, we will be using the phenomenological design. The phenomenological design, hard for me to pronounce that word, design explores and attempts to understand the lives of participants in order to explain why the research subject is a phenomenon. Our study will achieve this through conducting comprehensive, in-depth interview of participants, which will be video recorded. The transcripts and the video footage will be helpful for data collection purposes. This research design is particularly salient since my research proposal explores why the virus is disproportionately impacting this demographic versus the LGBT community at large. Study fund. In order to secure funding for this study, we will seek grant funding opportunities. This will assist researchers in providing financial incentives to potential participants. Researchers will recruit study participants that fit the following demographic: 18 to 35 years old, Black, trans women, male to female, homeless or low income, uninsured or underinsured, and frequently engaging in unprotected sex. This demographic and the following variables will be essential in forming a comprehensive sample size for this study. Additionally, ensuring that the sample size accurately reflects Black trans women who do not regularly use condoms during sex is critical, since the health behavior I will be examining is poor adherence to condom usage. Our aim is to recruit a sample size of 100 Black trans women from Atlanta, Georgia. Recruitment. Researchers will conduct recruitment for this study by actively outreaching to this vulnerable demographic at the following sites: bars, clubs, popular street locations, homeless shelters, bathhouses, beauty salons, among other locales. Additionally, we will place research study flyers at strategic locations throughout the city, such as laundromats, liquor stores, and in high-traffic LGBT communities or neighborhoods. Participants will be carefully selected based on how closely they meet study guidelines. Ultimately, we will be prioritizing quality over quantity. Theoretical framework. The theoretical framework we will base the research study on will be the social cognitive theory. The social cognitive theory is comprised of the following key constructs: observational learning, reinforcement, self-control, and self-efficacy. The social cognitive theory is applicable to the study in part because it examines the big picture of an individual's life, which includes their community, socioeconomics, family, and identity politics. The theory also highlights how people learn from watching their peers. Finally, the theory goes on to assert the assumption that individuals get inspired to change based on the actions of other individuals from their community. Closing key points. Key point 1. HIV is a serious threat among Black trans women. The percentage of new cases for this demographic, as stated multiple times, is 3 times higher than the national average. Key point 2. Access to care issues, lack of funding for HIV prevention programs, and accessibility issues surrounding PrEP are major contributing factors. Key point 3. There is a lack of available research solely focusing on why HIV is disproportionately impacting the Black trans women population. Key point 4. This proposed research study would be timely and salient given the impact of the virus in the lives of the members of this community. Thank you so much for tuning in and watching my video presentation. The next 2 slides will be my references. Thank you.